If you're currently smoking, then you've likely considered quitting in the past, or may even be debating quitting right now. However, each time the thought crosses your mind, something holds you back. Maybe you dread the withdrawal symptoms, maybe you're worried about gaining weight, or maybe you don't want to give in to your family's nagging. In this video, we'll explore some of these reasons, debunk some myths, and explore how you can overcome obstacles to successfully quit. The biggest challenge of deciding to quit is coming to terms with how smoking is an addiction to nicotine specifically. Addiction has three components: physiological, behavioral, and psychological. Let's break it down further. The physiological component is due to a cycle of nicotine binding to receptors in your brain, resulting in the release of the happy hormone, also known as dopamine. Each time you smoke, you experience pleasure, and you want to continue smoking as a result. Over time, those receptors get less sensitive to nicotine, and you need to smoke more to get the same high. Ultimately, when you stop smoking, your brain misses all that dopamine. Withdrawal symptoms like irritability, anxiety, and craving start. The second component is behavioral. You may be used to smoking in certain situations, such as in the morning with a coffee or when out drinking at the bar. Inhaling smoke from a cigarette becomes a ritual that's been repeated millions of times in your life. It can be tricky parting from such a familiar habit. And lastly, smoking has a psychological component. You may smoke in order to cope with a mental illness, in an attempt to lose weight, or simply because you believe it helps you manage stress. And we'll be diving more into these reasons later on in the video. In order to overcome addiction, it is important to first recognize that recovery does not happen overnight. Just like most worthwhile things, it takes time and perseverance, so be patient and compassionate with yourself wherever you are on your journey. Secondly, use nicotine replacement therapy, or NRT. Research shows that using a nicotine patch along with gum, sprays, or lozenges increases your chances of quitting smoking by at least 50%, because they help you manage your withdrawal symptoms. These products are often covered by insurance and health programs, but are available for purchase over the counter as well. Smoking cessation medications like Zyban and Champix are also available, so ask your physician about these options if you're interested. Another important step for overcoming nicotine addiction is identifying your triggers. Is it that morning coffee, the lunch break? Be very specific and also consider what you're using smoking as a coping mechanism for. From there, it's important to prepare to overcome these triggers, perhaps by finding healthier replacements for smoking. More on this soon. Lastly, remember to regularly motivate yourself. If you decide to quit, it's handy to write out all the reasons why you want to quit for you to look back on in the future if you need some inspiration. Also, give yourself regular pep talks. You are a resilient human being, and you do have the strength to quit. But if you find it hard to motivate yourself, feel free to ask your friends and family to motivate you and be your cheerleader. This will also hold you accountable. And if you need some extra incentive, think about how you'll reward yourself once you quit. Now, let's take a moment to reflect. Consider where you are in your smoking journey. How ready do you feel to quit? Would you want to use nicotine products? What actions should you take to obtain them if desired? Are there any personal triggers you plan to overcome? And how can you best motivate yourself? Feel free to pause the video and take a moment to reflect, or even jot your answers down to reference later. Another reason you may be continuing to smoke is that you believe smoking helps you manage your stress. However, let's debunk this. Smoking increases your blood pressure, heart rate, decreases oxygen in the brain, and causes your muscles to tense up. What does this sound like? Stress. You're making your body stressed when you smoke. But it doesn't feel that way, does it? Instead, you experience mental relaxation and pleasure because your brain is releasing dopamine. But what happens after it starts to wear off? You start feeling stressed again, often more than before because nicotine withdrawal kicks in. Anxiety, restlessness, and grumpiness are all withdrawal symptoms, and they can compound onto our stress to make us feel even worse. And let's be honest, being diagnosed with COPD or lung cancer will only increase your stress. In order to truly reduce anxiety in the long run, you need to find healthier coping mechanisms. But before we get into those healthy coping mechanisms, let's talk about another common reason it's hard to quit. You may be using smoking as a crutch for other conditions. This is similar to using smoking to quote-unquote manage your stress, but in this case, you're using it to manage a health condition you have, such as chronic pain due to arthritis, depression, or even another addiction. Again, it's important to recognize that smoking may be worsening these conditions rather than helping you cope. Let's take chronic pain, for example. Although the nicotine from smoking causes dopamine release and temporary feelings of pleasure, tobacco still has harmful effects on your body beyond lung disease and cancer that can cause painful conditions, worsen painful conditions, and even prevent you from benefiting from treatments. For example, smoking weakens your immune system and results in more carbon monoxide entering your body, causing less oxygen-rich blood to reach your bones and tissues. This can increase degeneration, resulting in conditions like arthritis, osteoporosis, and back pain. Furthermore, smoking prevents your body from healing as quickly and even reduces the effectiveness of treatments like surgeries and injections. In the case of depression, you typically already have a lower level of dopamine, resulting in feelings of hopelessness and apathy. Because nicotine from smoking stimulates dopamine release temporarily, your body grows dependent on this mechanism for producing dopamine, and your brain's natural mechanism of producing dopamine doesn't recover. As a result, continuing to smoke can prolong your depression because your nervous system is less motivated to recover. Consequently, using smoking to manage health conditions in the long run really isn't feasible. Thankfully, there are many healthier replacements for smoking that allow you to better manage stress and chronic conditions in the long run. Mindfulness and meditation involve living in the moment and not letting your mind run loose over worries. They also involve breathing techniques, which taken together allow you to stay calm and collected more often. Furthermore, practicing mindfulness increases your chances of successfully quitting and recovering from a relapse because you're better able to ignore cravings. There are a lot of free apps out there, videos, and websites that can introduce you to mindfulness and walk you through how to meditate, so feel free to check those out. Getting active is also a great way to manage stress and chronic conditions. Exercising releases endorphins, which are your body's natural painkillers. They're the reason for runner's high. Other options include having daily stretches, going for walks, taking up yoga. Consider adopting an animal if you need additional motivation to exercise. And each time you want to smoke, maybe try something like forcing yourself to take a walk around the block and try to delay the smoke. The craving may fade away by the time you get back home. Another strategy is to talk to people. Talking to someone about your problems and frustration is a great way to calm down. It helps you sort out your thoughts, allow you to realize that your emotions are normal and valid, and that you can make it through this. You can also write in your journal to express your feelings and express your frustration in a healthy way. Lastly, seeking counseling, medical help, medication, and even alternative medical treatment like massage or acupuncture, these are all good options to cope with stress, particularly if you have a chronic condition. Getting professional help can significantly reduce the impact your condition has on your quality of life and allow you to start feeling better in the long run. All right, so at this point, you might be thinking to yourself, I've heard about all this already, so there's no way that they actually work. But there is a reason that these habits or hobbies are suggested so often, and it's because they do work. There's no easy way to help you quit smoking, but these lifestyle changes and social practices have been shown time and time again to help you reduce frustration and pain. So consider giving them a shot, because you never know. And of course, sometimes there just isn't an easy replacement, and this is when you'll have to reflect on what's most important to you. Do you prioritize your health, or do you prioritize the comfort of smoking? Now it's your turn. Take a moment to pause the video and ask yourself how you're using smoking as a coping mechanism. What things cause you to reach for a cigarette more often? And what are some healthier options to those problems that you can use to replace smoking? Next, let's discuss another challenge many individuals face when contemplating quitting smoking: the stigma and even self-judgment that they face. Now, stigma can certainly make quitting more challenging. Sometimes people appear disapproving, They pressure you to quit or make quitting seem easier than it actually is. And this can result in a sense of frustration due to the lack of empathy and excessive pressure. This frustration and feeling of being misunderstood can then result in a sense of isolation. Consequently, it's important to be patient and educate the people around you in order to reduce the stigma. So to normalize the process of the challenge of smoking, I suppose, and the process of quitting. Lastly, do you ever notice that when people pressure you to do something, you feel a little rebellious and you don't really want to do it? This is called reactance. It's when you feel like your personal freedom has been threatened because of other people's pressures or orders, and so you behave in a contrary way in order to restore that freedom. While this is normal, it also backfires on you when it comes to smoking. If you feel annoyed by people urging you to quit smoking all the time, recognize that they come from a good place, but tell them how their external pressure makes you uncomfortable, and better yet, tell them what they can do to help you instead. Most importantly, recognize that your choice to quit is yours alone. Deciding to quit doesn't mean that you're letting other people boss you around or giving into pressure. Instead, it means that you're making a conscious choice to take better care of your physical and mental health. On the other hand, something that may be holding you back from trying to quit is past relapses. Relapse can be incredibly frustrating, and you may struggle with self-judgment and be scared to try quitting again due to the fear of failure. This is normal, and you should give yourself time to experience these feelings. But remember that relapse really is normal. The average smoker relapses over 10 times before successfully quitting smoking. So you're well on your way to successfully quitting. Secondly, remember to practice self-compassion. You're only human, and it's natural to make mistakes. It's hard, but try not to beat yourself up, and instead treat relapses as learning opportunities by considering what caused you to relapse. Did you underestimate the strength of withdrawal symptoms, not use nicotine replacement therapy, lack sleep, or lack a support system? How can you prevent this from occurring during your next quit attempt? The fact that you relapsed may also indicate that you require more support, such as through finding a quit buddy or talking to your family. It could also indicate that it's time to change things up and try new strategies like using NRT, so nicotine, delaying your smokes, and resolving causes of stress, such as if you have extreme work stress or family problems going on, it may be nice to find external ways to manage those problems. Another thing to remember is that a slip does not have to become a relapse. If you slip up and have a cigarette one day, don't let that send you into a downward spiral of starting to smoke again. Instead, forgive yourself and get back on track by exercising self-control and tossing those cigarettes away. Lastly, do try to remain optimistic. After all, the odds are in your favor. If you keep trying, one of these attempts is going to allow you to quit permanently, so never lose hope. To better prepare you for your quit attempt, consider involving your friends and family on your journey. Friends and family can serve as an excellent support system. In fact, there's scientific evidence showing that those who attempt to quit while being completely isolated are less likely to succeed. This is because your friends and family can help keep you on track. If you tell them you're quitting, they can help you when your cravings emerge by distracting you through conversations or activities, for example. They can also engage in healthier coping mechanisms such as exercise and mindfulness with you, and even hold on to your cigarettes for you to prevent you from relapsing. Furthermore, if you let your friends and family know that you're attempting to quit, they can be more prepared for your irritability and mood changes that are side effects of quitting smoking, and they'll understand that these moods won't last forever. Also, if they smoke as well, it's important to let them know that you will not be smoking with them anymore. Social smoking is a common habit, so ask them to help you avoid the temptation by not offering you cigarettes. You never know, you might even inspire someone else to quit with you. Now, another strategy to overcome stigma and self-judgment is the development of willpower. Now, chances are you probably said in the past, I don't have the willpower to quit, but this is false. Willpower is really just another word for mental strength. When applied to quitting smoking, Willpower is the ability to talk yourself out of smoking and convince yourself to stay a non-smoker, especially when faced with a craving. And anyone can develop willpower because mental strength can be improved through positive self-talk. Positive self-talk involves identifying the lies you tell yourself and replacing them with positive mantras instead. So for example, you might notice yourself thinking, darn it, I'm never going to manage to stop smoking for more than a day. So words like, I never can do this, or I should do this, but I don't do it, or I suck at this, get rid of those, and instead replace them with a positive action-centric phrase instead. Like, today I'm going to prioritize my health, or I will try my best today, something that feels genuine and truly speaks to yourself. By cultivating this habit, you can improve your motivation to start your quit smoking attempt or restart your quit journey if you have a slip up. Self-talk also reduces risk of future relapse because you can prevent yourself from acting on cravings. Besides, positive self-talk and willpower is kind of just an all-around good practice to have that'll improve other aspects of your life as well. Now, pause the video for a moment and try to forgive yourself for past relapses through some self-compassion. It will probably be difficult, but with practice, it gets a bit easier. Then, think of and write down some positive mantras that resonate with you that you can repeat to yourself to build willpower. Another common reason why you may be hesitant to quit smoking is out of fear of weight gain. Maybe you've heard stories from friends or family about feeling hungrier, eating a lot more, and putting on weight when they were attempting to quit. Or you've read articles about how it's common for smokers to have bigger appetites and slower metabolisms after quitting. But why is it common to gain weight after you stop smoking, especially during the first couple of months? Well, smoking does suppress appetite and increase metabolism, so quitting smoking might make you feel hungrier, and when you do eat, you burn calories slower. However, another factor is that when quitting smoking, people often miss the feeling of having something to do with their mouth and hands, and so they eat or snack to fill this need. People also tend to use food in the same way they use cigarettes, by using it to deal with stress, boredom, to reward themselves, pass time, or help them be social. In short, when quitting cigarettes, you're attempting to remove one major habit in your life. Accordingly, you start to take other actions to attempt to fill that gap. When these actions are eating unhealthily, this, combined with the body's lower metabolism without nicotine, is what leads to weight gain. On average, people gain about 5 to 10 pounds, or 2.25 to 4.5 kilograms, in the months immediately after they give up smoking, so it's completely normal to gain weight after quitting. However, if it's something that you're very concerned about, weight gain can definitely be minimized or even prevented. To counteract overeating, some good techniques include eating mindfully and portion control. Eating mindfully is about actively eating so that you enjoy your food more and are also more aware of how full or hungry you are to avoid continuing to eat on autopilot. So this includes doing things like eating slower, which is actually also healthier for you, allows you to digest things better. You also should avoid distractions by turning off the TV and putting away or turning off your phone while you eat. Try eating at the dinner table to create a mental association between your location and eating. And also, of course, enjoy your food. Appreciate the taste and the texture. The best thing is that after you quit smoking, your senses of smell and taste will improve. So take advantage of this to enjoy your food to the fullest. Another technique is portion control. During mealtime, this involves eating your meals on a smaller plate. By starting with smaller portions, you'll have to get up more for more food. Also, if you still feel hungry, wait 10 minutes before going back for seconds. There's a delay between when your stomach is actually full and when you feel full, so this delay period will prevent you from overeating. When it comes to snacking, if you buy larger bags or boxes of foods, especially snacks, try dividing the items into single-serve, ready-to-go bags. This is similar to eating chips from a small convenience store size bag instead of from a party size bag. It's a lot easier to overeat if you have a huge bag of snacks available right in front of you. If you do feel the need to do something with your mouth and hands to keep them busy, try using a toothpick, straw, or low-calorie, healthy finger foods like carrots, celery, sliced apples, or unsalted nuts. Sugar-free mints or gum are also a good option. And above all, make sure to drink water and stay hydrated, because a lot of the time when you think that you're hungry, it turns out that you might actually just be thirsty. Alright, so a tip to try out the next time you find yourself reaching for more food is to try asking yourself, am I actually hungry? If yes, what are some healthy options you can start with in a small portion? If no, what can you do to busy your hands and mouth instead? Consider talking on the phone or playing with a Rubik's Cube or other game. Try knitting or playing an instrument. These are some pretty fun options that you could try out, but of course, feel free to customize it based on your personal interests. And as a final reminder before we move on, if you practice the techniques and tips we mentioned, it's still very possible that you'll gain some weight. Although it may be discouraging to see quote-unquote bad surface results, it's important to remember that your weight really isn't a measurement of your health or your self-worth. Remind yourself that the actions you've been taking are all contributing to forming better eating habits, and that the health benefits of being smoke-free far exceed any problems associated with the minor weight gain you'll experience. And lastly, you might be hesitant to quit smoking because you might just think right now isn't a good time. You're stuck indoors all day, away from friends and family, and the lack of other things to do means it's harder to distract yourself from picking up another cigarette. While these are all valid concerns, there are also plenty of factors that make right now a better time to quit. Firstly, since we're in contact with fewer people and going out less, this means that you'll likely have to worry a lot less about social pressure. Many people who are attempting to quit smoking struggle with situations where they're meeting up with friends who they used to smoke together with. So that includes when you're at work, during a work break, or when you're just heading out to the bar on the weekend. If you're no longer faced with these situations, this eliminates a major source of triggers. If you do happen to live with someone who smokes, however, that's also a big challenge. So now would be a good time to talk to them about how you might work with each other if your stances on quitting smoking are different. So this could include trying to agree on rules about when and where you can smoke, or better yet, trying to convince them to decide to quit smoking. And when you're both prepared, you can be each other's quit buddies to hold each other accountable and provide support. Secondly, being stuck indoors might mean you have less responsibilities to deal with presently, such as less work or social obligations. This might mean you're less likely to experience stress as a trigger, which could let you quit more easily. But how should you deal with boredom? Although it might seem like your options are limited with the ongoing pandemic, if you have a lot more free time, now is a great time to engage in more exercise or other hobbies. Although it might seem counterintuitive to the whole stay-at-home idea, remember that exercise is most definitely considered an essential activity with how important it is to your health. Going outside to take a walk around the neighborhood is a great way to not only ease boredom, but also clear your head and improve your cardiovascular health. Also, since you're wearing a mask, you won't be able to smoke a cigarette at the same time. Besides taking a walk outside, there are also a lot of other equipmentless hobbies that you can pick up. To occupy your hands, you could practice drawing, or if you have ingredients for it, you could practice cooking by following some of the recipes on our channel. Alternatively, if you have the space at home, you could also do some simple stretches or walk around the house while listening to some free audiobooks online. So it's all about getting creative and just thinking about the hobbies that you'd be interested in taking up. Let's pause again and ask yourself, what are some potential hobbies that you want to pick up or skills you want to work on? How can you engage in them while at home? Now that we're reaching the end of the video, let's quickly review what we learned. First, we explored the complex relationship between nicotine addiction and your body, behavior, and mind, as well as ways to overcome this addiction. Then, we moved on to debunking the myth of smoking helping you manage stress and chronic conditions, and established how, instead of helping you, it's actually harming you, and that better coping mechanisms exist. Next, we explored the sensitive topic of stigma and self-judgement. Remember that your feelings are valid, relapse is normal, and that self-compassion and positive self-talk can go a long way in cultivating greater willpower. Our next topic was fear of weight gain, where we learned why we gain weight upon quitting and how to avoid this through healthy eating habits. And finally, we discussed why, despite being bored, quitting during this pandemic might have its benefits, such as reduced social influence and more time to develop a quit plan. While it's never easy to quit and there may be a lot of factors holding you back, remember that you are strong enough to start on this journey. We hope that this video helped you better understand some of your fears and maybe inspired you to find ways to overcome or reframe these obstacles. Thank you for joining us, and as always, if you have any questions, feel free to email us at drkurnu232@gmail.com. And if you'd like some support for quitting smoking, you can feel free to schedule a phone appointment with our clinic by calling us at 905-667-0783. Also, feel free to check out the other smoking cessation videos on our channel as well, on topics like how to quit and nicotine replacement therapy. Thanks again, and best of luck on your journey.